Hello all, my name is Josh. I am a final year medical student at the University of Southampton, and this is part one of my Introduction to Global Health Ophthalmology series webinar, as done with the Medics.Academy virtual elective May cohort. I've done the Medics.Academy virtual elective with loads of different medical students who will also be posting their webinars as well. So do keep an eye out for them and on the Medics.Academy YouTube channel. But we shall start on and go ahead with part one, Introduction to Global Health of Ophthalmology webinar. This is an outline of my webinar series. So I will start with an introduction now, and then I will do part one, which is going to be the importance of global health ophthalmology. Look out for my next videos, which will be part two, 3 causes of avoidable blindness, and part 3, a case study interview with Selfless UK charity. So really interesting things that we're going to be looking at and talking about. And an introduction to myself. I am a final year medical student at the University of Southampton. I have an interest in ophthalmology, medical education and research. And particularly, I guess the interest in ophthalmology and medical education is why I've culminated together and done this webinar. And why this topic? I found it interesting. It's something that I've looked at before. Not something that's traditionally in the medical school curriculum, but I think it's a really important topic to know about. Not just the concepts that you learn from a medical perspective, but also from a global perspective, global health, socioeconomic development, all types of really just interesting knowledge that's important to know. I put an asterisk because even though it's not in a medical school curriculum, it does come up on the Duke Elder exam. For anyone who's interested in that exam, it is search up more on it if you don't know what it is and you are interested in it. But it's just an exam that you can opt in to do as a medical student. It's all based on ophthalmology. If you do well on the exam, it will help your CV basically. So that's the Duke Elder exam. And now we'll go on to fully part one, the importance of global health ophthalmology. So as we start, I would like you all to think about how blindness can affect someone's life. Past the point that, of course, someone who's blind can't see, how else is that going to affect their life and the things that that individual can do? So just have a think about that for 10, 15 seconds. Right, so I think that's been about 10, 15 seconds. And in answer to this question, these are some of the consequences that I've thought of or that are common in literature on this subject. And there's so many, you can see it's really, really widespread in the devastation that's being blind or heavily visually impaired can cause. Economical consequences, social consequences, psychological or psychiatric consequences. They may have lost their independence with the activities of daily living. Can really severely affect education if you're blind or visually impaired as a child. It's going to increase your comorbid health. In particular, those who are blind and visually impaired are a lot more increased of falls and mechanical injuries. And those who are blind and visually impaired also have a lower mortality, a lower life expectancy than the normal population. So really, really severe consequences of being blind and visually impaired, which is kind of central to some of these concepts that I'll go into. So before we go on, we'll just talk about some definitions of visual acuity, of blindness, of visual impairment. The WHO definition of blindness is as such, and I used to think that blindness was just completely being able not to see and being like blacked out vision. Not necessarily like that. Visual acuity is a vision that is worse than 360. Now, to explain that visual acuity score, visual acuity is how well you see, basically. It's how sharp your vision is. 360, when it's written like that, means is how your vision will be measured by Snellen chart. Snellen chart is that chart that's very common in opticians and ophthalmology clinics, where it's a white background and letters on it. The letters get smaller as you come down the chart, and that's how they will measure your visual acuity. Visual acuity of 360 means that an individual with that visual acuity from 3 meters can see what a normal person can see from 60 meters. If you take that patient further away from the object than 3 meters, they can't see that object anymore. So you can see how severe that kind of vision is. So that is blindness. And the WHO definition of visual impairment is a visual acuity anywhere between 316 and 360. So once again, just to explain the concepts, and hopefully you're able to understand, a visual acuity of 316 means that an individual from 3 meters can see what a normal person can see from 16 meters. If you take the person further more than 3 meters away from the objects, they can't see it anymore. So that is the definition of visual impairment. And these definitions are with the caveat that these are for the best seeing eye and with appropriate refractive correction for the patient or individual as well. So glasses or contact lenses is refractive correction. And what's the definition of global health? Global health is the health of populations in a global context. It has been defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So that's a really important concept again, as we'll go on to discuss the importance of global health ophthalmology in this presentation. So why is global health linked with ophthalmology? Why are they so intrinsically important to one another? So in terms of answering this question, I thought I'll pose to you some statistics. I've put the number out, I've blanked it out, and I will ask you to guess the number with some of those options that we have at the bottom. I've got a number of statistics. We'll go through them. I'll tell you the answer, and then we'll discuss why they're so important. So to start with, blank percentage of visually impaired people live in low and middle income countries. 89%, 79%, 69%, or 59%. So just have a think about that. I'll give you a few seconds to think of what your answer would be. And so the answer for this is 89%, massive proportion of visually impaired people live in low and middle income countries. Blindness rates in high income countries are generally below 0.5%. In low income countries, blindness rates may exceed blank percentage: A, 1%, B, 2%, C, 4%, or D, 6%. So once again, just have a little think about that and think of what your answer could be. And the answer for this is 2%. Blindness rates in low-income countries may exceed 2%. And again, you're already starting to see the idea of the disparity that is really evident in global blindness. Blank percentage of adults under 50 are blind in sub-Saharan Africa versus 0.4% in high-income countries. Is it 3%, 6%, 9%, or 12%? So have a think about that. So the answer for this one is 6% of adults under 50 are blind in sub-Saharan Africa. Another example of the disparity. Blank percentage of the 39 million blind people in the world are women. So is it 50%, 57%, 60%, or 64%? So the answer for this one is 64%. Mind-blowing statistic. Massive proportion of the million blind people are disproportionately women and not men. So many low-income countries have a childhood blindness rate of around 1.5 per 1,000. High-income countries generally have a childhood blindness rate of blank per 1,000. 0.1, 0.3, 0.7, or 1.2. So the answer for this one is 0.3. High income countries generally have a childhood blindness rate of 0.3 per 1,000 people, a lot lower than low income countries and childhood blindness. Finally, maybe the most important statistic to truly understand global health ophthalmology, why we intervene in global health ophthalmology, is this statistic. By most estimates, up to blank percentage of global visual impairment and blindness is reversible. 30%, 50%, 66%, or 80%. So the answer for this one is 80%. A massive amount of the global visual impairment and blindness is classed as reversible. And as we go on, we'll think about what reversible actually means and why we target these conditions as global health interventions. So what those statistics have shown is that there's a massive global disparity that's evident in global blindness and visual impairment. It's disproportionately affecting those low-income countries is one of the main things that we've got from those statistics. And why is that? The conditions are multiple and ongoing. I can only summarize and scratch the surface of why that is. Lack of trained ophthalmologists in these countries, poor nutrition in some of these countries, of which is a risk factor of developing disease. A high proportion of low-income countries are in areas that have high UV radiation. That in itself is a risk factor for developing some diseases that cause blindness and visual impairment. And also in some of these countries or areas, the demographics of it is such that there can be poor practical access to treatment centres, more rural communities, less access as in infrastructure access for them to get to urban areas where the treatment centres might be, and or economical access to treatment centres, which may cost money to see an optician or see the ophthalmologist, and that may be a barrier for people to prevent treatment, which may later on progress to blindness or full visual impairment. And another interesting concept in global health ophthalmology is how it relates to global development. It's intrinsically linked. It goes beyond medicine. The consequences of blindness are already more significant for low-income individuals or those in low-income societies. So the effects that they cause, that we talked about before, are going to hit them harder. And also, global blindness and visual impairment can cause poverty. Again, linked to some of those other effects of blindness that we looked at. And then poverty is then linked to global blindness and visual impairment, as we looked at some of the why there's such a disparity between low-income countries and their higher rates of global blindness and visual impairment. So it's like a never-ending cycle of this massive macroscopic aspects of how global blindness and visual impairment is affecting global socioeconomic development of communities, of nations, of populations. So if we try and intervene with global health ophthalmology and try and target global blindness and visual impairment, you may well have a massive hand in helping poverty, helping bring people out of poverty, providing more opportunities for them, providing, in essence and in very general terms, socioeconomic development for an individual, for a population, for a country. So really, really massive potential for benefit with these interventions in global health ophthalmology. So now we'll just look at some of the causes of global blindness and visual impairment. And again, I'd like to think about what diseases are major causes of global blindness and visual impairment. So again, I'll give you 10, 15 seconds just to have a quick think about what some of these diseases might be. So I should have warned you that I was about to click off the slide there, but hopefully you did think of some of the answers to that, and they might be on this slide right now. These are the leading causes of global blindness and visual impairment worldwide. There's 7 causes. I've split them between conditions that traditionally have been affecting high-income countries more, or associated more with high-income countries, and conditions that traditionally, and certainly contemporarily as well, are affecting low-income countries more than high-income countries. So with high-income countries, I've highlighted cataracts, age-related macular degeneration, glaucoma, and diabetic retinopathy. As you may know, that of course is linked with high income countries generally have a demographic of an aging population. These are conditions that can all be related to age, chronic diseases of age, and that type of thing. Uncorrected refractive error, cataracts, glaucoma, corneal opacity, and trachoma are all linked with low-income countries more than they are high-income countries. Other than in cataracts and glaucoma, as you can see, that there are issues in both countries. In both types of countries, and the reasons why they are as prevalent as they are is different. The context is a bit different for why cataracts is so high in high-income countries as compared to low-income countries. The same with glaucoma, but they are truly global barriers in global blindness and visual impairment. So now, if we just focus on the right-hand column, low-income countries that have these causes of massive blindness and visual impairment, and we shall think about them in reversible disease and preventable disease. I find it useful to class them into this group and think about, or it'll help us think about why they're also so important in global health ophthalmology. So easily reversible causes in this case is uncorrected refractive error and cataracts. Uncorrected refractive error, I've classed that as reversible because uncorrected refractive error simply means your eye is refracting light either too much or not enough. Your cornea is refracting light too much, or your eyeball's the wrong shape. Very common. I have a refractive error, and that's why I'm wearing glasses. So glasses is how you correct refractive error, or contact lenses. It will change the refraction. It will mean that you see better at a better visual acuity. If I take my glasses off, my visual acuity without glasses is 322, roughly. So 322 means that from 3 meters, just to reiterate, from 3 meters, I can see what a normal person sees at 22 meters. That means that by the WHO definition of visual impairment, I, without glasses, would be visually impaired. So think about all the people that wear glasses and contact lenses that you may know. They would all be visually impaired without it. Certainly in the UK and maybe other high-income countries, it's just something that you don't even think about, wearing glasses or contact lenses and what life would be like without it. But unfortunately, as you can see, it's a global blindness it's a cause of global blindness and visual impairment. So it's a really easily reversible cause despite that. Cataracts as well, I've classed as an easily reversible cause because you do need surgery to fix cataracts, but actually cataract surgery is quite well known for being efficient. It's very cheap surgery to do. The benefits that you get from the cataract surgery has a really well-known public health model of increasing, of basically being economically efficient, because the person has their sight regained through the surgery, and they're able to not have falls. They're able to get back to work, and things like that. And also, it's a relatively easy surgery for an ophthalmologist to carry out. So again, really reversible causes, and yet they are some of the leading causes of global blindness and visual impairment linked with low-income countries. And if we look at preventable causes, these are corneal opacities and trachoma. And we'll go into some of these diseases in more detail in a later series of this webinar, but these easily preventable causes I've classed as such because some of the things that prevent them can be a good and healthy balanced diet, good hand hygiene, and insecticides. So that's why you don't really see too much corneal opacity, and you certainly don't see trachoma in high-income countries, but they are associated and endemic to many other countries worldwide. So with this concept of preventable disease and reversible disease, you can start to build a picture of avoidable blindness, blindness that is quite easy to, or should be theoretically easy to intervene and prevent and or treat. And yet there's a massive proportion of blindness worldwide that is avoidable. So really important concept in global health ophthalmology, avoidable blindness. Here's this definition from the International Agency for Prevention of Blindness. It is defined as blindness which could be either treated or prevented by known cost-effective means. Although there are many other causes of vision impairment, IAPB seeks to address the main causes of avoidable blindness in order to have the greatest possible impact on vision loss worldwide. So you can see just avoidable blindness is just a major target for global health ophthalmology. And it makes sense, doesn't it, to target those easily preventable or easily treatable conditions. We'll briefly touch on global health interventions. There are many interventions out there to combat avoidable blindness and support global health ophthalmology. From local charities to large non-governmental organizations to the World Health Organization itself, which is involved in an initiative called Vision 2020. This was formed in 1999 by WHO and IAPB, as previously mentioned, with a goal to eliminate global blindness by 2020. So this is an important case study in the concept of global health ophthalmology. I'm not going to go into it anymore for this particular series, but really interesting to read through the kind of things that movement instigated, some of the successes they have and some of the challenges that they've had as well since 1999. So that's Vision 2020. And that is for next time. So that is the end of part one. So thank you for listening. I hope you've enjoyed this quick introduction to global health ophthalmology. So please keep a lookout for part two. In part two, we'll focus on 3 avoidable causes of global blindness and visual impairment. Keep an eye out, like and subscribe to the Medics.Academy YouTube channel, where some of my colleagues as well that I met on the virtual elective will be posting their videos too. Thank you for listening. I hope you've enjoyed it, and have a good day. Cheers.